So thyroid nodules are very prevalent. The incidence may be as high as 50 to 60%, meaning out of every 100 patients that you see or 100 people that you see, the incidence will range between 30 to 40%. They will have nodules. These nodules may be malignant or they may be benign. That is, they may be harboring cancer or they may be without cancer. These thyroid nodules have up to 10% chance of harboring malignancy. Each and every nodule will have 10% chance of harboring malignancy. Now these nodules could be solitary, that is single, or it could be multiple. If it is multiple, it is called as multinodular goiter. If it is solitary, it is called as solitary thyroid nodule or an STN. Now, if this is in backdrop of hyperthyroidism, then it is a toxic nodular goiter. Or if it is in absence of hypothyroidism or euthyroidism, then it is just a solitary thyroid nodule and or a non-toxic goiter. Goiter is a term which is used for enlargement of thyroid. So any enlargement of thyroid is called goiter, and if you have a nodules in that, it is called multinodular goiter or toxic nodular goiter if it is showing the symptoms of hyperthyroidism. Now the malignancy is up to 10%. I would say in recent times when we have been doing a lot of PET-CT scans, the pickup rate of incident is up to 33% for thyroid cancer. I am Dr. Snehal Shah. I am a robotic head neck surgeon and I do robotic thyroid surgery for all those who want a cosmetic, I would say rather cosmesis, more than cosmetic, a scarless surgeries. I have access to that and I remove the thyroid nodules. Now these thyroid nodules have to undergo triple test. The first is the blood test, which is thyroid function test. Second is ultrasound to characterize how are these thyroid nodules, and the third is ultrasound guided FNAC, which are record, which is nothing but a cytology to find out whether these are malignant or not malignant thyroid nodules. Now coming to the nodules on ultrasound, this could be I would say there are certain characteristics which will define or which will make them high risk, and this characteristics are if they are solid, hypoechoic, microcalcification, taller than wider, if there is increased peripheral vascularity, and so forth. So these are some of the pinpointers on ultrasound which will guide us for our management further. So solid thyroid nodules have to be investigated, but they may not be treated. But there has been rising prevalence of this particular nodules or rising detection because of the multiple imaging modalities which are available, which are being used for other reasons, and you pick up this thyroid nodules. So thyroid nodules have to be detected, evaluated with lot of caution.